Hey there, it's Dr. Appleraju, your downtown digital general dentist. Today I want to talk about cavities and why you should get them treated. You know, I've been doing this for a long time, and sometimes we see some people walk into the clinic as new patients that have no problems, and that's fine. And quite often we've diagnosed them when we take the images or do our clinical exam, we've diagnosed them with cavities. And if you look at my other posts, cavities are infections in your teeth. They don't just go away. Sometimes we tend to monitor them and reassess them depending on factors like patient home care. Are they a low index for cavities? What's their diet like? What's their habits like? Are they pretty consistent with dental care, or do they wait every 5 years to show up at the dental office? These are some of the things that we are using to formulate a plan for you when you come in as a new patient. Now, what I've seen over many, many years is sometimes patients believe they've been healed when they do the exam and we've told them they need treatment, and they go to the front desk and nothing hurts. We totally understand it can be nerve-wracking for some people to come into the dental office and sometimes hear bad news like, hey, you've got some cavities here and some things we're concerned about. Now, typically in our office, we tend to be very conservative. We give the patient the benefit of the doubt. As long as they're coming in consistently, we can track things. This is one of the reasons why we certainly stress regular dental checkup exams and ongoing hygiene therapy, because we can track things, we can monitor what's going on in the mouth. Irrespective of benefits and cost, it's super important as your mouth is part of your overall health. So, one of the things we have seen, however, is that patients walk in, we diagnose them with treatment, and for whatever reason, they don't want to book their treatment. And then we will see them quite often in a year or 2 years, or sometimes even longer, 5 or 10 years, they don't come back. And now they need much more extensive treatment. Because you see, that small cavity that we were monitoring, or maybe it needed treatment and they decided, well, it's not hurting, I don't need to do anything. Well, it gets bigger. And now the tooth is broken. Quite often the cavity or infection is now into the nerve. Maybe they have an abscess or a swelling. Well, this problem that was quite small initially has now become magnified. It's grown. It's much, much bigger now. And now it's going to require much more extensive treatment, much more extensive treatment time, and quite often it's going to be a much larger investment for the patient to save their tooth or their teeth. Sometimes it's multiple teeth. And when I talk about that, patients are sometimes, kicking themselves for why they didn't do this earlier. So don't let this happen to you. We always, we have monitors in all our room. We show our patients exactly what's going on in their mouth, because sometimes they look in there and they don't see anything. This is one of the reasons why we take intraoral photographs, a scan, and digital x-rays, because we are super keen in educating and informing our patient about what's going on in their mouth, even though sometimes nothing is hurting. It's a different story when somebody shows up and they have a major toothache or pain. They are now highly motivated to do something about it because they can't function. They can't sleep, they can't eat, they can't go to work. They're taking a bunch of pain medicine until they can get seen at the dentist. So we don't want that to happen to you. So point being here is we often diagnose cavities and we're assessing a bunch of factors for you specifically, and your home care, your diet, and other factors, the anatomy of your teeth. Do you have crowding? All these factors, your history of fillings and this sort of thing. We're putting all of that together in a big puzzle and coming up with a plan that's specific for you. And we would love to see you. If you found this interesting or informative, we'd certainly love to see you as a new patient. And then we can educate you and talk to you about some of these things. If you have a regular dentist that you love, please see them on a regular and ongoing basis as well. Now, if you are looking to book with our clinic, we'd love to see you. Just give us a call or go to our website and book directly there. It's very easy. It takes 2 minutes, and you can do that 24/7 all year round. In the meantime, I hope you found this informative. Give us a like or share it with somebody that needs to hear it. Take care. See you soon.